Time now for this week's Health Matters. PA Lynn Szabo joining us over the phone. Again, it seems like every other week you've got to call in.
Yeah. Well, like we know, I hang out with sick people, and I had a pretty intense exposure, but so far so good. Okay. I just didn't want to spread the wealth.
Well, thank you very much. We really appreciate this. So you're down in the trenches with this whole Omicron thing. You were saying that you're seeing a lot of positive test results here, right?
Yeah, we're seeing more positive ones than negative ones. In fact, I think on Friday morning, mine was the only negative.
You were the only negative one. Wow. Man.
I think we all need to just do whatever you're doing.
Right. Well, hanging out with sick people is not a good idea. Well,
you seem to be getting away with it.
That's counterintuitive, sure. So
yeah, let's knock wood. But we've talked about that before, all the things that I do. So, but I can review it at another time.
Yeah, no, that's always good. We've talked about that too, just on the show during the week, the things that you've hipped us into. But so here we are, firmly ensconced in Omicron here in Del Norte. The hospitalizations and the deaths, of course, don't seem to be happening, but it's would you say it's just as virulent, just as prevalent out there as Delta was?
I don't think it's quite as virulent, but it's way more prevalent. So.
I guess that's what I meant. Not virulent like disease-wise, but like enthusiastic as far as it's spread in the community. I'm not a healthcare person, so I don't know what words to say.
Okay, so people on the whole don't seem as sick, but some of them are super sick, but nobody is scary Delta sick that I've seen. So, and I'm seeing outpatients, so I'm not in the ER or anything. But almost all of them are unvaccinated or unboosted. And there seems to be a lot of people that don't know they're supposed to get boosted. Certainly a lot of people that got J&J and they don't know that the recommendation is you switch over to messenger RNA vaccine. And they have no idea, if they didn't want to do that they have the alternative of a second J&J.
Oh, we may need to generate a video or do some content, get that word out, clarify if that's something that you're seeing in the community.
I see a lot of it. People are like really surprised.
Wow. Okay.
So what's the Del Norte to do if they go through the drive-through and end up getting positive? Or let's say before they're positive, before they're sick, the first thing a Del Norte should do is get vaccinated or boosted. So,
yeah, right. But, regardless, don't wait for the diagnosis. Just go ahead and take care of that. Right.
Right. But if you get the positive, know the names of the appropriate medications and ask for them. So I would advise people listening to get something to write with. Okay.
Okay.
And the first thing is we're burning up a lot of time explaining why ivermectin isn't really a thing and why you shouldn't waste your time on it. Wow. So, still, which is kind of disappointing, but it's not a thing. Don't waste your time on it. So anyway, first thing to write down, and these names are going to be familiar, but I want people, here's my hope today, is that people will be able to go to their provider and within the right period of time after they get a positive and ask for these drugs by name, because the providers are like barely a step ahead of the patients.
Wow.
And so this stuff is like hot off the press, as hot as it can be. And some providers, maybe who are a day behind on their reading or stuff, may not have the right information. And if you as a patient have the word, then you can trigger things moving in the direction quickly.
Okay.
In the right direction.
All right. So clip us in. Give us the crib sheet. What do we need to know?
Oh, the first one is molnupiravir. I always say this wrong.
I think we got it.
Spelled, MOLNUPRIAVIR. So this is for people who are 18 years or older with mild to moderate COVID with a high risk of severe disease. Okay. Here's why I'm asking people to write this down and know this word. You have to start it within 5 days of symptoms.
Okay.
Now, some of these rules are kind of flexible, like within 5 days of diagnosis. But really, for it to be effective, it needs to start within 5 days of symptoms.
Okay, and so
because they're telling you
There's a
They're
different
telling you not to get tested right away.
right, and so there's a difference then as far as getting a test result and feeling, actual symptoms.
Right.
Okay.
So try and go in sooner rather than later. So start within 5 days of symptoms. And here's what I'm seeing. People vastly underestimate the symptoms they have. And they'll call it anything else but possible COVID. So they'll say, well, this is the cold I get every year, or this is my allergies. And they usually come this time of year. And actually, it's not. And they end up with a positive COVID test result, and they're shocked.
So you say for ages 18 years and older, mild to moderate COVID-19 with high risk of severe disease. Does that mean somebody with comorbidity?
Yeah. So, maybe an elder, maybe diabetes, maybe on immunosuppressive drugs for autoimmune disorders, stuff like that. This one is not for pregnant or nursing women.
Okay, that's important.
And this one, that's important because almost none of the pregnant women in my practice actually are immunized. They've all kind of refused. So this particular drug only has a 30% relative risk reduction. Remember when we first started talking about it, how it seemed like it was the beginning of the end for this virus, and we were so excited about 30% relative risk reduction. Now this is kind of like the J&J of treatment.
Oh no!
A little bit like the also ran, but here's the thing to remember: it's also the one that in Del Norte we're going to have. All of these drugs are going to be in super short supply, and so I think this is the one that we're going to get first. So.
Okay, so is this the matter of like if this is the best you can do, go with that?
Right.
Okay.
Go with that.
All right.
Okay. The next one is Paxlovid.
Write this down.
Remember, write this down. Paxlovid. So this is actually a combination drug of two protease inhibitors for ages 12 years and older and more than 40 kilograms, which is about 85 pounds.
I was going to ask what that was in America. Thank you.
It's actually 40 kgs. I mean, this is an aside, but kids, most of their drug doses are calculated in milligrams per kilogram.
Sure.
Anyway, so we go back and forth. So symptomatic mild to moderate COVID disease with risk of severe disease. So maybe somebody with juvenile rheumatoid arthritis, or maybe somebody has got bad asthma. There's a lot of kids up here with that. Or maybe somebody who's an insulin-dependent diabetic. It's contraindicated in pregnancy and for anybody with severe liver or kidney disease. So contraindicated means a no-go.
Right.
Okay. So it needs to start within 5 days of symptoms. So again, make sure that you ask your healthcare provider about it. And this is what made the other one kind of stand in the shadow. This has an 88% relative risk reduction of hospitalization or death.
Wow, that's something. Wrong, right on. Now, I notice also this is not for pregnant women. Just reiterating the fact, it's a good idea if you're pregnant or thinking of being pregnant anytime soon, get vaccinated, get boosted, because so far these two antiviral treatments aren't for you.
Right. And COVID in pregnancy is a more severe disease. There is, Roxanne Alsbury checks in with us every once in a while from her fellowship in Houston, where she says they see a lot of kids that have it and a lot of preterm labor, a lot of concern about how the COVID during a pregnancy is going to affect the child after birth. So it's not benign. This particular drug, Paxlovid 2, has a lot of drug interactions, and it's kind of a nightmare to prescribe because anybody who's on any kind of medication for like blood pressure or diabetes that's just going to be kind of difficult for a provider to kind of sort out what drugs should be held and what drugs should be continued.
Right.
Now, these are, the last I heard, and this was about 10 days ago, Paxlovid was going to be available at Safeway in a week. And so that was 3 days ago, and as far as I know, it is not available in the county.
Wow, okay. And again, just to clarify, these are both by, these medications are by prescription.
Right.
Yeah.
By prescription, they're both oral, and Some of them have been some doses have been allocated to Humboldt County. I think only 100 though.
Whoa.
Only 100. And the email I got was nothing, said nothing was being allocated to Del Norte yet. So that email is about 4 days old. And that Humboldt County wasn't going to send any up.
Huh.
That's a bummer.
One of the things I heard, Lynn, is some of the cities that have been really hit hard by Omicron are already beginning to see cases fall off, like back east. And I guess my question is Del Norte still waiting for its peak of Omicron?
I think so. I think we're really close to the peak. I don't think we passed the peak yet, though. Mm-hmm. But just by the numbers of positives we're seeing.
Wow. Yeah. We lag behind by a number of weeks, sometimes months like that too. But it was Dr. Stutz was saying he thought by the end of this month we'd be past the peak. Right? Am I remembering that right?
I believe that was what he was saying.
End of this month, yeah. But I think you have to remember that peak numbers in diagnosis is different from hospitalizations and deaths. Mm-hmm. Peak numbers. Mm-hmm. So they're like behind. But here's the exciting news, the new one.
So am I still writing this one down?
Yeah, you totally should write this one down.
Okay, hit us again.
If they're not going to bring the drug or the treatments to Del Norte, they are in Humboldt, and there's no problem with Del Norte's going down to Humboldt to get medication. Might be one somebody wants to look at. So Sotrovimab, which is SOTROVIMAB, aka MAB4. So for 12-year-olds and older, and this is the only IV treatment that we've talked about. So this is intravenous, and it's for specific risk groups with mild to moderate disease. So this is what's going to be hard for people to understand, is that when they say specific risk groups, I looked through what they were talking about, and there was a lot of, there's like about 7 obscure immunodeficiency diseases, and then unvaccinated people with those diseases. So they're going to prioritize unvaccinated people.
Okay.
But there's still room for vaccinated people to get the medication if their immunodeficiency is severe and their doctor recommends it. So there's got to be doctor to provider communication to get this. So, for example, somebody who's got cancer diagnosis and has chemotherapy, even if they're boosted, they still have a shot at this. Mm-hmm. Okay. This is unknown if it should be used in pregnancy or nursing. They're recommending a 4-hour pump and dump for nursing, and they're not really super supportive of pregnancy. It kind of depends on the specific medical situation.
What's a pump and dump?
Pump and dump is if a woman is nursing and she's on medication which shouldn't be transferred to that infant.
I got you. So you just don't. You throw out the milk. You don't. Gotcha. Okay.
Yeah. So this particular drug has a 79 to 85% relative risk reduction, but a 1 to 2% hypersensitivity, so bad allergic reactions.
Okay.
So it's given in the hospital. And I'm going to give you, this is where people should be paying attention, writing things down. Right now, it's only available at St. Joe's.
Wow.
Which is also called Providence St. Joe's. Mm-hmm.
And that's in Eureka, to clarify for any listeners down there.
Right. So at the infusion center down there at Providence St. Joe's, their number is 707-269-3607.
That number again?
707-269-3607. And their fax number, 707-269-3755. And then if it was me, a last resort to call would be the main hospital number, which is 707-445-8121, because I think they're going to stop answering the phone at some point.
Oh, wow. asked to
But
talk
if you
to
call,
you.
yeah, if you call the main number, you'll get in voicemail, or kind of like automated hell. But you can just keep hitting 0 and ask to talk to a human. That'd be helpful.
Okay.
These drugs are super limited right now, and will be tightly regulated. So there's not going to be any way that a provider can just kind of make sure it was provided to somebody. Like if my father was ill and I thought my father really needed it, there'd be no way I could get it to him.
Wow.
So they are really locking down on us and making sure we're doing this right. And lots of providers are facing steep learning curves. So luckily at UHS, I have to shout out to Katie Castle, who's my supervising physician, and is making like this up to the minute information available, and this is really helpful in my learning curve.
Wow, right
so
on.
I appreciate. Yeah.
Well, that leads me to a question, Lynn. Is there any organized effort to ensure that Del Norte providers are up to speed on all of the various requirements and or contraindications of these medications?
I mean, other than what they understand they're ethically bound to do, and like all of our resources and stuff that we have electronic access to all have interactions, and also the pharmacies have interaction tools built into it that are kind of automatic. I have been getting really good information from UHS, and not so much actually from Del Norte community, but I imagine I might not be in the front seat for that at Del Norte community, so it's possible it could be happening. I'd be unaware of it.
Yeah,
I have no idea what's happening.
The reason I asked is it sounded like you were saying earlier that it's going to be important for people individual patients to understand, A, these medications exist, and B, to have some idea of when and for who they are appropriate to prescribe to.
Right. I think that would be in everybody's best interest. They may not, I think average patient may not have the tools, but they still have the internet. And that's one of the reasons I'm actually taping this show today, because I'm trying to encourage people to be aware of them. This is kind of like an ACT UP model during the AIDS. Do you remember during the AIDS crisis? Mm-hmm. You guys were in the Bay Area. You remember ACT UP when they closed the bridge?
Yeah.
Well, part of what they did is that they also educated patients on what to ask for. And that was the first time really that there was like an organized patient advocacy effort. Mm-hmm. And so I think that's really important here, because I think if you go in and you talk to a provider and you specifically have some idea what you're asking for, you may not have to know all the pharmacokinetics or every single little piece of science on it, but if you at least know the name of the drug and you have to get it within the first 5 days, you are a super step ahead in advocating for yourself.
I've got a question. We're talking about the availability of these medications in Del Norte, and Humboldt gets 100, but they're not going to send any up here. Who's in charge of all of that? Like, who's in charge of making sure that there's enough of these sorts of medications in Del Norte? Is it a matter of the state allocating resources, or is it a matter of us asking for them?
I think it's a matter of the state allocating it, and I don't think Humboldt just woke up and decided to not share.
Right.
I think in order to get these drugs, they had to agree to certain things, and one of the agreements was to let Del Norte get their medications when it was their turn.
Okay.
But that also, if that decision was being made by somebody, let's say in Sacramento, then I don't think they're thinking that Del Norteans go down to Humboldt County constantly.
I'm sorry, you don't think they're thinking what? Say that again.
Del Norte people have the capacity to go down to Humboldt to get the things they need.
Oh, they think, well, of course, we're just right up here next door.
Yeah, whether it's something at Costco or whether it's to see a particular specialist, or whether it's actually to try and access treatment at St. Joe's Providence Infusion Center.
Who
Oh,
who would be advocating to ensure that there was these medications available to people in Del Norte, here in Del Norte? Who goes and advocates for that with the state or whoever else is in charge of distributing this medication?
well, it should be happening on lots of levels. So, I think that on a political level, probably state, um, you know, the state people that are elected, names are escaping me at the moment. Maybe you
Jim
can fill
Wood
that
and
in.
Mike McGuire?
Right. I think they would be the most logical. I also think that the public health officer would probably be in on this. And I think they are. I think these conversations are happening. And it's possible that something has changed from 4 days ago.
Yeah, I'm not
Oh,
suggesting that they're not. I just
Yeah.
don't know
yeah.
who does that.
And also Humboldt is, I mean, Omicron, everything comes on a couple of weeks earlier for Humboldt too. So if you're going to stagger the release of a limited resource like medications like this, it kind of makes
Right.
sense.
I guess if you're playing the numbers game too.
Hmm.
I mean, the amount of drug that's probably going to the Bay Area or Los Angeles or even Sacramento is probably way different.
Yeah. Yeah. I mean, and when you're making decisions like this from afar, you have to play the numbers
Right.
game like that. That's your job.
Yeah, but I think it signals to me that if Humboldt County only got 100 doses,
Mm-hmm.
then there's probably not much available.
Right.
And
In this surge, they've had deaths down there too as well, correct?
right? Absolutely.
Yeah. Yeah.
They had a 20-year-old that died in the last week.
Mm-hmm. Mm-hmm. Wow. So,
So,
yeah. So we're hovering around up here. We don't have the hospitalizations or deaths, and hopefully we won't. But I can see how we would just be a lower risk.
Right. But I don't think that keeps somebody from going down there. But if I drove down there to try and get the Sotrovimab, I actually think it might be a 50-50 chance that I could get it. Even if I met all their criteria. And remember, how they evaluate people's need with this specific criteria changes at any moment in time, depending on who else needs it.
Mhm.
Kind of like a transplant list, you know?
Yeah.
You can be toward the top of the transplant list. Maybe the need for the individual is pretty crucial, but the need overall versus the supply is, hugely disproportionate.
Yeah,
So
and
you know what I mean?
that changes on the fly too every day. Yeah, gotcha.
Yeah, probably depending on who you talk to.
Mm-hmm.
So, yeah, up to us. So that's why I want people to have these words, because I think patients who can advocate, they don't have to have a lot of knowledge of a particular drug, but if they even know that it exists, that's like a step ahead. If they can use the word.
I don't want to get you into be doing a segment on the electric company or Sesame Street here, showing my age. But let's hit those terms again and maybe spell them out and make sure everybody's clear on what they need to ask.
Okay, so the first one they also ran, I guess, but probably better than nothing, is molnupiravir. So MOLNUPRIAVIR. So this is when you start within 5 days of symptoms, and this has the 30% relative risk reduction. Okay.
Okay.
The next one is Paxlovid, which might even be available in some pharmacies here. They say they were supposed to get it about 3 or 4 days ago, but I haven't heard that it's in town. So Paxlovid is PAXLOVID. This is for symptomatic mild to moderate, and you have to start within 5 days. 88% relative risk reduction of hospitalization and death.
Mm-hmm.
And then the new one, this is the one I really think people ought to pay attention to. This is the only IV one. The other ones are oral drugs. So Trovimab, so SOTROVIMAB. And this is the one where you can get it at the infusion center at St. Joe's. And I would, as a patient, I would call. So their number is 707-269-3607. And their fax number is 707-269-3755. And then, of course, the main number of the hospital is 707-445-8121. I think what's going to happen is the nurses are going to stop answering the phone because they're going to get overwhelmed. So call the workaround, call the main number, and just keep going, punching zero until you get to the nice volunteer lady and ask to speak to a human.
Nice wrap up, Lynn.
What?
Nice wrap up. Thank you very much.
Yeah. So one thing I want to add too that I said from the nurses at UHS I would mention is that the CDC changed the amount of time after you get diagnosed that you're supposed to be isolating.
Mm-hmm.
But the public health officer here did not change it, so it's not 5 days. And then you can go back as long as you're wearing a mask and social distancing. We're still in Del Norte at the 10 days.
Yes.
So you isolate for 10 days. So people are getting confused about that.
I thought he said he was going to change that, but that hasn't happened yet?
It's not happened yet. He sent us out a note this week and said, no, it's still 10 days.
Oh.
Yeah, that was a decision our public health officer, Dr. Aaron Stutz, made for us here in Del Norte. And I expected a bigger stink to be made about that, but I'm not sure how many people are really following those guidelines in the final analysis.
Yeah, it's really I was just out shopping today, and as near as I can tell, very few people are following any of them.
Right.
Oh, yeah, they aren't. What's sad is they kind of think they are, but they're so not. Okay, I'll isolate after I make a little quick trip.
Well, people were doing that when it was Delta. They were,
right.
Yeah, because I know, I think the pharmacist at Walmart said something about that people were showing up sick. It's like, you're not supposed to be here.
Oh, wow.
Right, but some people sadly don't really have the support. They don't have other choices, and some people kind of don't get it.
Yeah.
And then some people are not into following instructions anyway.
Yeah.
So
I saw somebody wearing the chin mask today, which it's like, why are you even bothering doing that?
Thanks. What is that, a feed bag? Oh, Lynn, anything else for this week's Health Matters?
No, I think I made my point.
What's that? Say that again.
I think I made my point.
You made your point. Good. That's it. And so how much longer do you have on your isolation, your quarantine?
I probably by tomorrow at 8:30.
You can go.
I'm probably not super quarantined, but I've already had one negative test, and I never felt sick, although the person who was near me was really sick.
Wow.
My hope is that she's getting better.
Well, you are the COVID warrior princess.
I am, for sure. But
Yes.
there's more of us.
There's
a lot more of it.
We're selling posters now.
Yeah, we're going to get you your own swag.
Okay. Well, my parents are over it. I sent it to my parents and I didn't even get comment back. So.
We got a whole thing. We'll set up a fan club. They're going to be called Zabots. It's going to be a big thing.
All right. I get to be the Zabinator, huh? That's actually one of my clinic names.
Really?
So, yeah.
Well, Lynn Szabo, PA, thank you so very much for this week's Health Matters. And what a coincidence. Your quarantine ends just about the very minute you have to go back to work.
I know, but that's assuming that my test is negative. So
okay.
8 o'clock, I'll find out probably 8:45.
Gotcha. Okay. Well, best of luck with that, because I know you probably want to get back into the trenches. I can't imagine you're the kind of person who takes a week off and goes, hey, this is great.
Oh, I'd lose my mind. Lose my mind. So.
All right. Well, then we will talk this next week, either in person or over the phone again. It's Health Matters with PA Lynn Szabo. Lynn, thank you.
Thank you. Bye-bye.
Bye-bye.